Hello, parents. This is Jessica Schumann with Breathe, Pennsylvania, and I'm happy you can join me for a presentation regarding asthma and allergies. Breathe, Pennsylvania is a nonprofit organization with a 10-county service area. Our mission is to empower Western Pennsylvanians to breathe better and live healthier through education and awareness of lung health in our community. Our programs include direct lung disease education, patient assistance programs, school asthma initiative programs, sleep apnea, tuberculosis education conferences, Asthma Day, Smokeless Saturday, and Smoke Free for Life programs. So let's start. What is allergic asthma? Well, that's what we're here today to speak about. The most common type of asthma is allergic asthma. Allergic asthma is caused by breathing in an allergen or a trigger, and it starts to irritate the lungs and cause asthma changes. There's approximately 26.5 million people in the United States with asthma. And of that 26.5 million people, about 60% of them have allergic asthma. So that's like 6 in 10. And of school-age children, that number is closer to 80%. When we breathe in an allergen from the air, 3 things happen in our lungs when we have asthma. The first is the muscles around the airway start to tighten or squeeze. This is why we hear a wheeze. The inside of the airways start to swell in reaction to that trigger, and we start to produce excess mucus in the lungs. This is what makes us cough. So on the last slide, we spoke about that you're breathing in an allergen and it causes some changes in the lungs. So what is an allergen? It's something that's airborne. It can be found year-round, and we find it on the inside or the outside of buildings or our home. Examples we'll touch upon today is pet dander, dust mites, pollen, in-home pests like cockroaches, and mold and mildew. So let's first talk about what is pet dander. Pet dander is tiny flakes that shed from the skin or the fur of an animal, like dandruff. It is found on all fur-covered pets that we find in our home, such as cats, dogs, hamsters, guinea pigs. You can also find this on horses, any kind of farm animals. So we want to look at this as what is in our homes. It is easily spread in the air and becomes airborne, and we breathe it in. So how do I protect my child if this is their allergen? First, I want to minimize their contact with any type of pet. I want to make sure that if they're touching pets, dogs, cats, horses, that they're washing their hands. We want to keep pets out of our beds and off of our sofas. So that's not probably something we always think of, but that's one of the first places that we always allow our pets is in our beds. We want to make sure we clean. So we want to dust hard surfaces and make sure we're vacuuming properly. We also want to make sure if the pet is in our bed that we are cleaning the bedclothes weekly. Keep pets groomed and clean. So we want to make sure that they're brushed to loosen up that dander and bathed. And if a child is severely allergic, we want to have complete avoidance of pets in the home. So let's get into dust mites. Dust mites are a very misunderstood allergen. They're confused sometimes with bed bugs, but they are not bed bugs. They are extremely tiny little critters that are actually too small to be seen. They're microscopic. They are found in all household dust, but their bedrooms, that's their favorite place, such as our beds, our mattresses, their pillows, and the carpet. So how do I protect my child if this is their allergen? We need to encase the mattress or pillow in an allergy-resistant covers. These can be found at local stores like Target or Walmart, and they will have a special level for dust mites. We want to wash bedding, blankets, and stuffed animals in very hot water weekly. Again, we need to clean, clean, clean. Dust hard surfaces and vacuum. Dust mites like carpet and any soft surfaces. So we want to make sure we continue to vacuum, especially with a bagless vacuum with a canister in it. That way the dust is not recirculated from the bag and it can be removed after each vacuum into the garbage and removed from the home. If a child is severely allergic, you may need to replace your carpet with a hardwood floor. That way it's easier for the cleanliness. You don't get as much dust gathering in the carpet, and so you'll have less dust mites. Now let's talk about pollen. Pollen is outside in the air year-round, but some seasons the pollen is higher than others. Pollen levels are the highest between 5 a.m. and 10 a.m. in the morning. Have you ever looked outside in the early morning when the sun is coming up and you see what looks like dust in the air? That's pollen that has been shot up into the air and is slowly making its way back to the ground. So when do symptoms show up? So when you have a pollen allergy, you want to watch for when your symptoms are the worst. That will show you which pollen is what is bothering you the most. So tree pollen shows up in early to late spring. Grass pollen comes in at late spring to midsummer, when ragweed pollen is late summer to early fall. Now, if your symptoms are much worse during the late summer to early fall, more likely this is a ragweed pollen than a tree pollen. So you want to pay attention to this, especially if you're using a certain allergy medication. So how do I protect my child if this is their allergen? So we want to avoid going outside in the morning while the pollen is airborne. If they happen to be going outside early for football practice or going to school or going into camp, you want to make sure they're properly medicated per your doctor's prescriptions. You want to talk to your doctor about appropriate allergy medication. They're all different. We can do inhaled through the nose. They could add them to special inhalers. We could take a pill that just helps with the allergens. So you definitely want to speak with your doctor in regards to the best regimen. After being outside, it is very important to wash the hands and face. Pollen sticks to our hands and our clothes. So if we're out in the woods or walking around or at soccer practice, it's important that when they come in, they change their clothing, they wash their face and their hands to remove their pollen from their body. If your child is severely allergic, this may require allergy shots to help the body get used to the allergen, or what we call desensitization. So let's talk about home pests. We're going to focus on cockroaches. Cockroaches, remains, and debris are a major cause of allergic asthma. Their saliva and feces and shedding body parts are easily swept up into the air and inhaled and cause a trigger. How do I protect my child if this is their allergen? Well, most likely, if you have cockroaches, you're going to need professional remediation. You need to bring in somebody who can remove the cockroaches properly. To work towards not allowing cockroaches into the home, we want to keep food stored in plastic containers with tight-fitting lids, and we want to avoid using cardboard boxes as a form of storage. Cockroaches usually come in because of leaky faucets or water areas, and they seek out food, so pet food or human food that is left out. Also, when we have cardboard boxes or we bring in cardboard boxes, they have a tendency to have cockroach eggs in them, which can cause an infestation. So this is why avoiding using cardboard boxes as a form of storage and keeping your food in plastic containers with tight-fitting lids is important. You want to make sure your garbage is secured with a lid. And again, clean, clean, clean. You want to dust hard surfaces with a moist cloth and vacuum. The importance of using a moist cloth is that if the shedding body parts are laying anywhere on the hard surface, you don't lift them into the air and create them to be airborne. Again, you want to repair leaky faucets and pipes because that is an area where cockroaches like to be, in the moist area. Fungi, that's what mold and mildew is, causes year-round allergy symptoms. When the spores are disrupted, they become airborne. They can be found inside or outside the home, and they love damp areas for growth. So how do I protect my child if this is their allergen? I'm going to limit outdoor activity when mold levels are high. I want to wear a mask when I'm gardening or doing yard work. We want to avoid situations where if there's moisture in the ground and they're weeding, they're not breathing it in. There's a lot of mold and mildew outside. So we want to wear a mask to avoid breathing that in. We want to keep inside humidity levels below 35%, and we can do this with a dehumidifier or an central air conditioner or an air conditioner in the window. We want to use exhaust fans to improve airflow through the house, and we also want to use exhaust fans when we are in the shower or in the bathroom to get and remove moisture. Again, we want to clean, clean, clean. It's very important to keep areas clean when you see mold or mildew to make sure that you can kill it and get rid of it. We want to repair leaks in the home, and we want to remove any sources of dampness. So this is a time to always look around. If we see something that's damp, it definitely needs to be fixed. So let's talk about the symptoms we should be watching for when it comes to allergic asthma. We're going to see a dry cough and or wheeze. We're going to see itchy, watery eyes, sneezing, tight chest, or feeling that their chest feels like something's sitting on it. They may be short of breath due to the changes in the lungs, and they may have a runny or stuffy nose, and you may find them waking up at night more often. These are all symptoms that you need to take to the doctor so you can create a treatment plan on not only just asthma, but the allergic triggers of the asthma, and then the remediations in the home. So how is allergic asthma treated? With the help of your doctor, you may be prescribed the following medications. You may get a rescue inhaler or albuterol for onset of quick acute symptoms of asthma. This medication helps open the airways in 3 to 5 minutes to offer easier breathing. If your asthma is out of control, you may receive a control inhaler or an inhaled corticosteroid. This will help control any kind of asthma symptoms by keeping the airways inflammation down and the mucus down. Some of these are specifically made for allergies. They may offer you an over-the-counter or prescribed allergy medication while you're also taking inhalers. They will ask you to take this at certain times or all year round, depending on when your allergy symptoms are the highest. You may have to use oral corticosteroids. This would be a short set of medications that your doctor gives you to help decrease inflammation quickly and get your asthma under control. Again, we may also see allergy shots. When we have allergy shots, we're basically using a homeopathic method of like cures like. So you get allergy shots to desensitize the body from the allergen so it doesn't irritate the lungs or the body. Something to remember, not everyone who has asthma is triggered by allergies, and not everyone who has allergies also has asthma. So it is very important to work with your doctor to create the best treatment plan for you and your child. Some very exciting news. We now have our Asthma Action Workbook available to download from our website at www.breathepa.org. You can choose English or 5 additional languages: Arabic, Spanish, Nepali, Somali, or Swahili. This workbook will help you understand the changes in the lungs, how to use a spacer and a peak flow meter, understanding early warning signs and triggers, and also has a perforated asthma action plan included. Please go to our website to download yours today. At this time, I would like to thank you for joining me for the parent program, Asthma and Allergies. I'm Jessica Schumann with Breathe, Pennsylvania. Please join us for additional classes coming up, 15-minute programs for parents. Thank you and have a great day.